Mesothelioma is an oncological disease. Look at this picture, shows that mesothelioma in lungs, pleura, then CT findings. Look at this. PET scan and MRI findings. Look at this. A detail going on. Introduction. Mesothelioma is a rare but aggressive form of cancer that primarily affects the mesothelium, the protective lining covering the lungs, abdomen, heart, and testicles. It is most commonly associated with asbestos exposure and has a poor prognosis due to its aggressive nature and late diagnosis. A definition: mesothelioma is a malignant tumor that originates from the mesothelial cells lining the pleura, lungs, peritoneum, abdomen, pericardium, heart, or tunica vaginalis, testis. It is often linked to prolonged asbestos exposure. Etymology: the word mesothelioma comes from mesothelium, the thin layer of tissue covering most internal organs. From Greek meso meaning middle, theli meaning nipple or layer, and ema, a suffix indicating a tumor. Types: 1. Pleural mesothelioma affects the lining of lungs. Most common type. 2. Peritoneal mesothelioma develops in the abdominal lining. 3. Pericardial mesothelioma affects the lining around the heart. It's rare one. 4th, testicle mesothelioma involves the tunica vaginalis of the testis. Very rare. Causes: 1. Asbestos exposure. The primary cause occurring through inhalation or ingestion of asbestos fibers. 2. Occupational exposure. Works in construction, shipbuilding, mining, and manufacturing industries. 3. Environmental exposure. living near asbestos minus or using asbestos containing products. 4. Genetic factors. Some individuals may have a genetic predisposition. 5. Radiation exposure. Rare cases have been linked to radiation therapy. Risk factors. 1. Prolonged exposure to asbestos. 2. Occupation in asbestos related industries. 3. Living in someone exposed to asbestos. Secondary exposure. 4. Genetic mutations increasing susceptibility. 5. History of radiation therapy to the chest and abdomen. Complications. 1. Pleural effusion, fluid buildup in the lungs. 2. Respiratory distress and difficulty breathing. 3. Metastasis to other organs. 4. Heart complications. Pericardial involvement. 5. Bowel destruction. Peritoneal mesothelioma. Pathophysiology. Pathophysiology of mesothelioma. Step by step process. 1. Asbestos exposure. Inhalation or ingestion of asbestos fibers, commonly from occupational or environmental exposure. Fiber become lodged in the mesothelial lining of the lungs, pleura, abdomen, peritoneum or heart, pericardium. 2. Chronic inflammation and cellular damage. Asbestos fibers trigger a persistent inflammatory response. Macrophages attempt to phagocytose the fibers but fail, leading to release of pro-inflammatory cytokines. 3. DNA damage and genetic mutations. Reactive oxygen species and reactive nitrogen species generated by inflammation cause DNA damage. Mutation occurs in tumor suppressor genes, leading to uncontrolled cell growth. 4. Uncontrolled cell proliferation and tumor formation. Loss of apoptosis regulation due to gene mutations results in abnormal mesothelial cell proliferation. Tumor growth leads to thickening of the mesothelial lining and formation of nodular tumors. 5. Angiogenesis and tumor progression. Tumor cells release vascular endothelial growth factors, promoting new blood vessel formation, tumor become highly visualized and spread locally. 6. Local inversion and metastasis. Cancerous cells invade adjacent tissues, including the lungs, parenchyma, chest wall, and abdominal organs. Pleural effusion, fluid buildup in the pleural cavity, or ascites, fluid in the abdomen, occurs due to vascular leakage. 7. Systemic spread or organ dysfunction. Advanced mesothelioma can metastasize via lymphatic and hematogenous routes, progressive respiratory failure in pleural mesothelioma, or bowel obstruction in peritoneal mesothelioma leads to life-threatening complications. Signs and symptoms. Pleural mesothelioma. 1. Shortness of breath. 2. Chest pain. 3. Persistent cough. 4. Unexplained weight loss. 5. Fatigue. Peritoneal mesothelioma. 1. Abdominal pain and swelling. 2. Nausea and vomiting. 3. Bowel obstruction. 4. Loss of appetite. Pericardial mesothelioma. 1. Chest pain. 2. Heart palpitations. 3. Fluid accumulation around the heart. Testicle mesothelioma. 1. Swelling in the testicles. 2. Lump formation. Diagnosis. 1. Imaging test. X-rays, CT scan, MRI, PET scans. 2. Biopsy. Tissue sample analysis. Needle biopsy. Thoracoscopy. Laparoscopy. 3. Blood test. Biomarkers such as mesothelial and osteoprotein. 4. Pulmonary function test. Assess lung capacity. Nursing diagnosis. 1. Impaired gas exchange related to tumor compression. 2. Acute pain related to pleural peritoneal irritation. 3. Anxiety related to prognosis and treatment. 4. Risk for infection related to compromised immunity. 5. Ineffective breathing patterns related to pleural effusion. Medical management. 1. Surgery, removal of tumors, pleurectomy, extrapleural pneumonectomy. 2. Chemotherapy, cisplatin, pimetoxide to slow tumor growth. 3. Radiation therapy, targets cancer cells and reduces symptoms. 4. Immunotherapy, boost immune response against cancer cells. 5. Clinical trials, investigating new treatments. Nursing management. 1. Monitor respiratory status and oxygen therapy. 2. Pain management using analgesics. 3. Nutritional support for weight management or maintenance. 4. Psychological support and counseling. 5. Educate patients on symptom management and treatment side effects. Treatment options. 1. Surgical treatment, extrapleural pneumonectomy, removal of lung and pleural lining, cytoreductive surgery for peritoneal mesothelioma. 2. Chemotherapy, platinum based chemotherapy, cisplatin, carboplatin. 3. Radiation therapy, external beam radiation therapy for localized tumors. 4. Targeted and immunotherapy, Keytruda and Opdivo. 5. Palliative care, focus on symptoms relief and improving quality of life. Psychosocial medicine. 1. Counseling and support groups, providing emotional support and coping mechanisms. 2. Family and caregiver education, informing families about the disease and how to support patients. 3. Stress management techniques, meditation, breathing exercises, and relaxation therapy. 4. Financial and legal guidance, assistance with medical expenses and legal claims for asbestos exposure. 5. Spiritual and holistic care, addressing personal belief and alternative therapies. Prevention. 1. Avoiding exposure to asbestos by following safety regulations. 2. Wear protective equipment if working in high risk industries. 3. Regular health screening for at risk individuals. 4. Proper disposal of asbestos containing materials. 5. Raising awareness about mesothelioma. risk. In conclusion, mesothelioma is a rare but serious cancer with strong link to asbestos exposure. Early diagnosis remains challenging, and treatment options primarily focus on prolonged survival and improving quality of life. Prevention through asbestos regulation and awareness is key in reducing the incidence of this disease. Ongoing research offer hope for better treatment outcomes in the future. Thank you. Have a nice day.